not hopelessly broken, and he believes he can fix it. His name is Republican Representative from Pennsylvania, Tim Murphy. He's sponsoring the most sweeping overhaul of our mental health system to date. He's also a lieutenant commander in the U.S. Navy Reserve who works with wounded warriors with PTSD. Thank you very much for joining us, Congressman. Let me first tap into your skills as a clinician in this situation. With the shooting, we're learning more about the background, that he was being treated for depression and anxiety and insomnia, that he had self-reported himself having TBI. We don't know what the collection of drugs were or how they were monitored. We do know he was going through an evaluation process for PTSD. Thursday, Army Secretary John McHugh said the shooter gave no sign during a psychiatric exam last month that he was likely to commit violence. How does this situation shape up to you in terms of the level of care he was receiving?
Well, that'll be part of the post-mortem I'm sure the Army will look at. When we are treating someone with PTSD, and understand I'm not speaking for the Navy, the Army here, but as a Navy psychologist, I know there's a lot of levels you look at. You look at that person's background. You look at if there's social stressors. You look at the kind of medication they're on. Was it right? Was it effective? You have to review the TBI and understand that a lot of symptoms of look like PTSD can actually be related to a brain injury and can be misdiagnosed. You see what kind of levels of support, and you also do a risk assessment to understand if that person on certain medications can increase the risk for some problems. They have to be closely monitored throughout this whole process. He may have had great care and failed. He may have had problem care and, of course, didn't respond. All those things will have to be reviewed very carefully.
Sticking with the military aspect of this for just one more question. The suicide rate for veterans. Yes, it's measured during wartime, 2004 to 2008. Can't gloss over that. Certainly going to exacerbate all stresses. But we're up to 20 suicides a day. The rate of increase 80% greater than the rest of society. It's an acute need. The question is, do you have acute care? Do we know how to deal with this and treat it?
Well, there have been a lot of emphasis within the military to build resilience, do some prevention. Unfortunately, the studies have said that it hasn't been working effectively, in part because many of the people trained to do the work haven't been following through on the evidence-based type of care. You need a lot more training with people. Two, I don't think there's enough mental health professionals throughout the military to deal with their needs. Three, many of these suicides are not people who are currently active duty reserve or guardsmen, but some are also people who are veterans have left, and there's big problems with follow-up care for them within the VA system. We need more care. We need to continue to do this. There's a lot of great work being done in the military, but we've got to make sure it's all thorough enough and there's enough people to do it, and in this case, we don't know yet.
Okay, so there is no silver lining to what happened at Fort Hood. It is an unmitigated tragedy for the victims involved, the families involved, even the shooter's family. This is terrible. He has a wife, he has kids, he has family who has to deal with it. However, the timing, sometimes things may happen for a reason. You're holding hearings about a bill now that you say can fix this system that is hopelessly broken. Some context. The military better set up than the rest of society to deal with mental health pretty much any way you want to measure it. 350,000 people who are mentally ill right now warehoused in jails because there are only 35,000 beds available in the country, as you well know. Getting people to receive treatment is very hard. You can't hold them for more than 72 hours in most places without a hearing. You say you can fix these things. You have the Helping Families and Mental Health Crisis Act. What will it do?
Well, it does several things. It provides more training for police so they don't enter a situation with someone who's mentally ill, add to the level and get that person even more problems, will do jail time. We need to have more hospital beds. Medicaid currently has a limit on that. I'm not talking put everybody in the hospital, but when someone's in the middle of a crisis, a psychotic or depressive breakdown, they need a place to go. What oftentimes happens now is they're brought into an emergency room, and that emergency room may do something called boarding. They may sedate the person, tie them down, where they remain for hours or days without getting into proper care. We have to make sure we have more psychiatrists and psychologists trained and have access to the primary care pediatrician. We have to make sure that parents can have a closer role in treating and being aware of the treatment of their teen or their young adult person. We need more research in this area. This bill does all those. And for those, instead of saying we will put you in an involuntary commitment and put you in jail, we also need some ways like they have in the state of New York where it's something called assisted outpatient treatment. Now, it's only 1% of the population, but it's something for those people who are struggling and they're at risk for their own safety to get them on medication, to get them care. We need those options available, too.
Sounds great. We know you're a Republican. We know you have 20, maybe more Democratic co-sponsors, but politics still at play. This bill should have been passed a long time ago. I am willing to play the shame game here. What do we know about what politics you're up against in passing this bill?
Well, what's going to happen is some are going to want to keep the status quo. I've been talking to a lot of my colleagues. In fact, this morning, even a couple of Democrats and a couple of Republicans said, I need to sit down with you and hear about the bill. People know we've got to do something. But like anything else, there's also misunderstandings and some, we'll just call misunderstandings on the bill. I'll have to help them get informed and up to speed on what's there, because there's some groups that want to keep this going the same way. Look, we can't keep going the same. We are failing as a country in this. We oftentimes approach this in a third world way of just putting people in jail, letting them be homeless. And I understand people have a right to be part of their care. But when you have a lot of people who themselves may not even be aware that they have a problem, we've got to wrap our arms around them and help them through this. And so some of the system has to be shaken up. Some of the ways the federal government handles this has to be shaken up.
Some of the main pushback that's not political, because one part of your bill is going to start vetting programs and prove that they work before you get funding. That's going to wind up cutting into people's pet projects, a.k.a. pork. You're going to get political pushback on that. We'll watch that part to make sure it's a fair debate. But then there's the, hey, if you make somebody know that they're going to be forced into care, then you'll chill people from coming forward. And if you start disclosing more about their medical condition to people, supposedly in the interest of making sure they don't get access to guns or other things like that, well, that's an invasion of privacy. What do you think of those 2 points of criticism?
Well, that's absolutely false. That's what the HIPAA laws are supposed to protect confidentiality, and those who don't understand the bill. We had a hearing yesterday, and someone was commenting on it who admitted he didn't even read the bill. What we have is certain laws that protect privacy, but there's also regulations that go with it. They're oftentimes misunderstood, where doctors then may not talk to the family at all, and the family doesn't know when their child has appointments, what medication treatments they should be on, and the doctors aren't hearing the history. You can't diagnose a psychiatric condition without a history. Our law makes it very clear by taking the regulations and not adding to it, but tweaking it and making it very clear when you can talk to someone and when you can't. We're not into breaking confidentiality. We're into helping that be better. And as far as the assisted outpatient treatment goes, again, that's 1% of the population. When someone's headed down the road to having problems, we don't want to wait until they're about to kill themselves or someone else. We want to wait when there's a concern for their safety to help them get help. In New York, it's been very effective to reduce incarceration, homelessness, and hospitalization by 70+ to 80+%. It's a more compassionate way than just putting them in jail or shoving them out of the hospital.
Sounds like a great bill. We encourage everybody to read it for themselves. They can get a lot of information about it online. We will watch the politics of it, Congressman, because this is a situation where it can't be about left and right. It's got to move forward. We need to do better. This situation proves it, and we have too many examples every year. Thank you for joining us, and we're going to have your lead forensic psychiatrist, Dr. Michael Wellner, who testified on your behalf. He's going to be on the show today to make the clinical case for why he believes this needs to happen. So thank you, sir.